My name is Leah Herman, and my presentation will be discussing Huntington's disease. So first, what is Huntington's disease? Huntington's disease is a rare inherited or genetic condition that causes progressive breakdown or degeneration of nerve cells in the brain. Huntington's disease has a broad impact on a person's functional abilities and usually results in movement, thinking or cognitive, and psychiatric disorders. Next, what are the causes of Huntington's? Huntington's disease is caused by an inherited defect in a single gene. Huntington's disease is an autosomal dominant disorder, which means that a person needs only one copy of the defective gene to develop the disorder. The DNA error that causes Huntington's disease is found in a gene called Huntington. This gene was discovered in 1993. Everyone has the Huntington gene, but only those that inherit the mistake, known as the Huntington mutation, will develop Huntington's and risk passing on to their children. Genes are made up of the nucleotide letters A, G, C, and T, which form a code that is read in groups of 3. Huntington's is caused by a stretch of the letters C, A, G in the Huntington gene, which repeat over and over too many times. This is known as the CAG repeat expansion. In the Huntington gene, most people have around 20 CAG repeats, but people with Huntington's have around 40 or more. Every person who has this CAG repeat expansion in the Huntington's disorder gene will eventually develop the disease, and each of their children have a 50% chance of developing Huntington's. So as seen in the picture on the left side of the slide, a family where the father has the disease and the mother does not can reproduce with children either having the gene or not. Next, there are 2 types of Huntington's disease. The first type is juvenile Huntington's disease. This affects children and teenagers and is very rare. Children with Huntington's have symptoms similar to those of someone with Parkinson's. The second type is adult onset Huntington's disease. This is the most common form of disease, and people with adult onset Huntington's usually develop symptoms in their mid-40s and 50s. Next, there are 5 stages of the disease. First, the preclinical stage, then the early stage, followed by the middle stage, the late stage, and finally, the end-of-life stage. So the first stage is the preclinical stage. This is where mild symptoms begin to appear, but the individual has not actually been diagnosed by their doctor yet. Symptoms of Huntington's disease most commonly start between 40 and 60 years of life, but they can appear as early as 2 years or as late as 80 years. The affected person can usually carry out all their day-to-day work without requiring any assistance. Mood problems may appear at this stage. Next is the early stage. This is where the symptoms become noticeable enough to arrive at the diagnosis of Huntington's disease. Although people with this disease carry most of their daily activities, some activities do require help from people around them. There may be twitches or slight tremors in the hands or face, which may be missed as nervous tremors. The affected people can usually go or drive to work by themselves. There may be trouble in eating and sleeping. Thinking becomes difficult for some tasks that appear simple earlier. The person grapples with depression, anxiety, and irritability. Then we have the middle stage. At this stage, people with Huntington's are unable to carry out most of their activities on their own. Substantial help is needed from the people around in activities involving domestic and financial chores. People start experiencing difficulty in swallowing, and slurring of speech may be noticed. They might experience difficulty in walking and maintaining balance. There is drastically worsening in the thinking ability of the affected person. The person might experience difficulty in learning new things and remembering information. Depression and irritability become very evident at this stage. Next is the late stage. By this stage, people with Huntington's disease require assistance in all areas of life and become bedridden. Movements become extremely slow and rigid. They are unable to convey what they feel because of speech impairment. The inability to swallow necessitates the use of a feeding tube that is inserted surgically into the stomach. People may become constipated or have trouble urinating. Extreme difficulty in falling asleep or staying asleep is experienced. Finally, we have the end-of-life stage. This is where the patients become confined to the bed completely and dependent on others for all of their activities. They need help to live the last few months or years of their lives peacefully and in the best way they can. Patients may choose whether to spend their last moments in a hospital or at a familiar place such as their home. Patients with Huntington's disease usually live for anywhere between 10 and 20 years after the symptoms first appear. The cause of death usually is a complication of Huntington's, such as pneumonia. Many symptoms were indicated throughout the advancement of the disease in the previous slides describing the 5 stages, but here is a list of overall symptoms one would experience having Huntington's. These symptoms include, in the early stage, involuntary, dance-like movements, depression and suicidal thoughts, mood swings, aggression or irritability, anxiety, and difficulty learning new things. The symptoms in the later stages include worsening of uncontrolled movements, problems with balance or coordination, rigidity or stiffness, slowed movements, tremors, slurred or slowed speech, difficulty swallowing and feeding yourself, loss of memory and judgment. How early the stages begin and how severe the symptoms are differ among patients with Huntington's. These differences have been linked to variations in genetic mutation causing the disease. Lastly, there is currently no cure or treatment which can halt, slow, or reverse the progression of the disease. However, there are many treatments and interventions that can help to manage the symptoms. You can manage the symptoms of the disease by medications to lessen the mental and physical effects of the disease, therapy for depression and anxiety that often accompany Huntington's disease, exercise therapies to help movement problems, or access to support services in your community. And there are some of the resources that I used for this presentation.